They rolled their eyes when she offered to help. The seasoned paramedics scoffed at the woman in the faded hospital scrubs working behind the medical supply counter. But when Marcus Rodriguez found himself trapped in gridlock traffic with a dying patient and no way to reach the hospital, Claire Hartwell would do something that would leave these emergency responders speechless. What happened next in that cramped ambulance would challenge everything they thought they knew about expertise, judgment, and the power of quiet competence. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow, I've saved something extra special for you. The morning mist clung to the hills surrounding Cedar Falls, Oregon, as Claire Hartwell unlocked the doors to MedTech Supply at exactly 6:30 a.m. The small medical equipment store sat in an unremarkable strip mall between a coffee shop and a dry cleaner, its modest storefront giving no hint of the sophisticated inventory within. Claire moved through the familiar routine of turning on lights, checking overnight orders, and preparing for another day of serving the local medical community. At 42, Claire possessed an understated presence that made people overlook her in crowded rooms. Her dark blonde hair was perpetually pulled back in a simple ponytail, and she favored comfortable scrubs in muted colors over the fashionable attire worn by the medical professionals who frequented her store. Her hands, though, told a different story. They moved with the precision of someone accustomed to intricate work, and her eyes held a depth of knowledge that seemed incongruous with her humble position behind a retail counter. The store reflected Claire's meticulous nature. Every piece of equipment was organized with surgical precision, from the basic blood pressure cuffs near the entrance to the specialized surgical instruments locked in glass cases toward the back. She knew the location and purpose of every item, could explain the subtle differences between similar products, and had an uncanny ability to anticipate what her customers needed before they asked. Claire's morning routine was interrupted by the familiar rumble of diesel engines outside. Through the window, she watched 3 ambulances from Cedar Falls Emergency Medical Services pull into the parking lot of Murphy's Diner next door. The paramedics and EMTs had made this their unofficial morning gathering spot, and Claire had grown accustomed to their boisterous presence during shift changes. She returned to her inventory checklist, noting that she needed to reorder suture kits and IV supplies. The numbers came naturally to her, patterns and calculations flowing through her mind with practiced ease. Most people assumed that running a medical supply store required little more than basic business sense, but Claire understood the critical nature of her work. When emergency responders needed equipment, lives often hung in the balance. The bell above the door chimed as Marcus Rodriguez entered, his imposing frame filling the doorway. As the senior paramedic for Cedar Falls EMS, Marcus carried himself with the confidence of someone accustomed to making life-and-death decisions. His salt and pepper beard was meticulously groomed, and his uniform bore the crisp creases of someone who took pride in his professional appearance. Behind him followed Brad Thompson, a younger paramedic whose swagger suggested he viewed himself as Marcus's protege. "Morning, Claire," Marcus said, his tone polite but distant. "We need to restock our trauma supplies." "The usual order." Claire nodded and pulled the standard inventory sheet from beneath the counter. She knew their requirements by heart, but maintained the professional courtesy of consulting the list. The new hemostatic gauze came in yesterday. It's supposed to have better clotting properties than the previous version. Brad snorted softly. "Yeah, well, unless you've used it in the field, I wouldn't know how to judge that." Claire's fingers paused briefly over the order form, but she continued writing without comment. She had learned long ago that her customers often dismissed her input, viewing her as merely a vendor rather than someone with relevant expertise. It was easier to stay quiet than to endure the condescending explanations that followed when she demonstrated knowledge beyond their expectations. Marcus examined a new portable defibrillator displayed on the counter. "This, the latest model?" "Yes. It has updated software for pediatric patients and improved battery life," Claire replied, moving to gather their supplies from the back room. "The charging time is 40% faster than the previous generation." "How would you know that?" Brad asked, leaning against the counter with a smirk. "You read the marketing brochures." Claire emerged from the back room with their order, setting the boxes on the counter with deliberate care. "I make it my business to understand the equipment I sell." Understanding specifications and using equipment in real emergencies are 2 different things, Marcus said, not unkindly but with the unmistakable authority of experience. When someone's life is on the line, you need people who've been there. Kevin Walsh, a veteran EMT with 25 years of experience, entered the store as Marcus spoke. His weathered face and graying temples spoke to decades of emergency response, and he carried himself with the quiet confidence of someone who had seen everything. "Morning, folks. What are we discussing?" "Just explaining to Claire here about the difference between theory and practice," Brad said, clearly enjoying the perceived teaching moment. Kevin glanced at Claire, who was quietly completing their order with professional efficiency. He had always found her knowledgeable and helpful, though he had never given much thought to how she had acquired such familiarity with medical equipment. "She seems to know her stuff," he offered diplomatically. "Knowing product specifications isn't the same as knowing medicine," Marcus replied, signing the receipt Claire had prepared. "No offense, Claire, but there's a reason we go through years of training and certification. When you're dealing with trauma, knowledge from books or catalogs doesn't cut it." Claire handed him the receipt, her expression neutral. "Of course, I hope everything meets your needs." As the paramedics gathered their supplies, Tom Fisher, the newest member of their team, burst through the door with barely contained excitement. "Guys, you need to hear this. There's been a massive pileup on Interstate 84. Multiple vehicles, possible fatalities. They're calling all available units." The casual atmosphere in the store immediately shifted. Marcus straightened, his demeanor transforming from relaxed to focused in an instant. "How many units are responding?" "Everyone," Tom replied, slightly out of breath. "Fire department, state police, life flight helicopter." "It's bad, Marcus. Really bad." Brad was already heading for the door, the earlier conversation forgotten. "We need to move. Now." Kevin grabbed an extra box of trauma supplies from the counter. "Claire, we'll settle up later." "Take what you need," Claire said quietly, watching as the three experienced emergency responders prepared to face what sounded like a catastrophic situation. Marcus paused at the door, his expression serious. "Thanks, Claire. We'll be back for the rest of our order later." As the paramedics rushed out, Claire stood alone in her store, listening to the fading sound of sirens as emergency vehicles raced toward the interstate. She moved to the window and watched the ambulances disappear into the distance, their red and blue lights reflecting off the low-hanging clouds that still clung to the valley. Claire returned to her inventory, but her mind wandered to the emergency unfolding on the interstate. She knew Interstate 84 well. It was the main corridor through the mountain pass, with steep grades and sharp curves that became treacherous in poor weather conditions. A major accident there would present significant challenges for emergency responders, not least of which would be the difficulty of getting patients to the hospital quickly. The store's phone rang, interrupting her thoughts. "MedTech Supply, this is Claire." "Claire, it's Dr. Patricia Vance from Mercy General. I need you to prepare an emergency order for us. We're expecting multiple trauma victims from the interstate accident, and our supplies are running low." Claire immediately shifted into crisis mode, her fingers flying across the keyboard as she accessed the hospital's account. "What do you need, Dr. Vance?" "Everything. Surgical kits, blood products, hemostatic agents, airway management supplies. The emergency department is preparing for the worst." As Claire compiled the order, she found herself thinking about the paramedics who had just left her store. Marcus, Brad, Kevin, and Tom were skilled professionals, but they were about to face challenges that would test every aspect of their training. Interstate accidents often resulted in complex trauma cases that required immediate, decisive action. "I'll have everything ready for pickup within 30 minutes, Claire assured Dr. Vance. "Do you need it delivered directly to the emergency department?" "Yes, please." Time is critical. After hanging up, Claire moved with purpose through her store, gathering supplies with the efficiency of someone who understood the urgency of the situation. Her movements were precise and economical, betraying a familiarity with emergency protocols that seemed inconsistent with her role as a store clerk. As she packed medical supplies into organized containers, Claire's mind drifted to memories she usually kept carefully suppressed. Images of operating rooms, surgical lights, the controlled chaos of trauma surgery. She had once moved through that world with the same precision she now applied to organizing inventory. But those days felt like another lifetime. The sound of approaching sirens pulled her back to the present. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. Through the window, she could see emergency vehicles racing past in a steady stream, all heading toward the interstate. The magnitude of the accident was becoming clear, and Claire felt the familiar tightness in her chest that came whenever she was reminded of her former life. She loaded the hospital's emergency order into her delivery van, a modest vehicle that served as her primary means of transportation and mobile supply unit. The van was equipped with temperature-controlled storage for sensitive medical supplies and organized storage systems that allowed her to locate specific items quickly. As Claire drove toward Mercy General Hospital, she passed more emergency vehicles heading in the opposite direction. The local emergency services were clearly mobilizing every available resource, which suggested that the interstate accident was as serious as Tom had indicated. The hospital's emergency department was a scene of controlled preparation when Claire arrived. Medical staff moved with practiced efficiency, setting up additional trauma bays and preparing for the influx of patients. Dr. Vance met her at the ambulance bay, her expression grave. "Claire, thank God you're here. We've just received word that there are at least 12 vehicles involved in the accident, with multiple critical injuries. The first ambulances should be arriving within the hour." Claire began unloading supplies with the help of hospital staff, her movements automatic and efficient. As she worked, she listened to the radio communications between the emergency department and the responding units. The reports were sobering. Multiple patients with suspected internal injuries, possible spinal trauma, and several victims requiring immediate surgical intervention. "Unit 17, this is Mercy General Emergency. What's your ETA?" came the voice over the radio. "Mercy General, Unit 17. We're en route with a 34-year-old male, multiple trauma, possible internal bleeding. Patient is conscious but deteriorating. ETA 25 minutes. Claire recognized Marcus's voice on the radio, his professional calm barely masking the urgency of the situation. 25 minutes to transport a critically injured patient from the interstate to the hospital. In many cases, that would be acceptable, but with internal bleeding, every minute mattered. Dr. Vance noticed Claire's focused attention to the radio communications. "You seem familiar with emergency protocols." Claire finished unloading the last of the supplies before responding. "You learn to understand the urgency when you work in medical supply. Lives depend on having the right equipment available at the right time. Have you ever worked in emergency medicine?" The question hung in the air for a moment longer than necessary. Claire's past was something she rarely discussed, and she had become skilled at deflecting such inquiries. "I've always been interested in the medical field," she said diplomatically. Dr. Vance nodded, accepting the non-answer as she was called away to prepare for the incoming patients. Claire finished her delivery and returned to her van, but instead of driving back to the store, she found herself listening to the ongoing radio communications from emergency responders still at the accident scene. The reports painted a picture of a complex emergency that was straining local resources. Multiple patients required immediate attention, but the remote location of the accident and the challenging terrain were complicating evacuation efforts. Several victims remained trapped in their vehicles, requiring extrication before they could be transported to the hospital. Claire sat in her van in the hospital parking lot, torn between returning to her quiet store and the growing awareness that her skills might be needed. She had spent years building a carefully constructed life that kept her away from the intensity and emotional demands of emergency medicine, but situations like this tested her resolve to remain on the sidelines. Her phone buzzed with a text message from her assistant manager, asking if she should open the store since Claire had been gone longer than expected. Claire realized that she had been sitting in the hospital parking lot for nearly an hour, lost in thought and memories of a different life. As she started her van to return to the store, another emergency call came over the radio. "All units. All units. We have a code red trauma victim requiring immediate surgical intervention. Patient cannot wait for hospital transport due to severe internal hemorrhaging. Requesting emergency physician to accident scene." Claire's hands tightened on the steering wheel. Code red meant that a patient was dying and needed immediate medical intervention that exceeded the capabilities of field paramedics. In her former life, she would have been the surgeon racing to save such a patient. Now, she was just a medical supply clerk listening to someone else's emergency. But as she drove back toward her store, Claire couldn't shake the feeling that this day was far from over, and that the carefully constructed barriers she had built between her past and present were about to be tested in ways she had never anticipated. Claire had barely returned to MedTech Supply when the afternoon brought an unexpected surge of emergency responders seeking additional equipment. The magnitude of the interstate accident had quickly overwhelmed initial supply estimates, and various fire departments, police units, and medical teams were scrambling to replenish their resources. The store's bell chimed constantly as uniformed personnel entered, their faces grim with the weight of the ongoing crisis. Claire moved efficiently between customers, her knowledge of emergency equipment proving invaluable as she guided responders to exactly what they needed without the usual lengthy explanations or product comparisons. "I need heavy-duty trauma shears and emergency blankets," announced Captain Lisa Rodriguez from the Cedar Falls Fire Department, her voice carrying the exhaustion of someone who had been working the accident scene for hours. Claire immediately retrieved the requested items, adding extra batteries for the shears, and including reflective emergency bivvies that provided better heat retention than standard blankets. "These bivvies are more effective in cold weather," she offered quietly. Captain Rodriguez examined the upgraded blankets with appreciation. "Good thinking. The temperature's dropping, and we've got several patients showing signs of hypothermia." As the fire captain left, 2 state troopers entered, followed closely by a helicopter medic from Life Flight. The accident scene was clearly stretching resources beyond normal capacity, and Claire found herself serving as an unofficial supply coordinator for multiple agencies. The helicopter medic, Dr. Jennifer Martinez, approached the counter with barely controlled urgency. "I need a complete airway management kit. We've got a patient with facial trauma who needs immediate intubation, but our backup supplies were damaged when another vehicle leaked hydraulic fluid." Claire moved swiftly to assemble a comprehensive kit, including multiple laryngoscope blades, various endotracheal tube sizes, and backup ventilation equipment. As she worked, she listened to Dr. Martinez's radio communications with her flight crew. "Base, this is Flight 7. Patient is a 28-year-old female, unconscious, suspected cervical spine injury with facial trauma. We need to secure the airway before transport, but visibility is compromised due to blood and swelling." Claire paused in her preparation, her hands hovering over different intubation options. Without thinking, she reached for a specific laryngoscope blade and video intubation device. "For facial trauma with limited visibility, you might want the videoscope," she said quietly. "The camera provides better visualization when traditional methods are compromised." Dr. Martinez looked up sharply, studying Claire with new attention. "You're familiar with difficult airway protocols?" Claire realized she had revealed more knowledge than she typically displayed to customers. "I try to understand the equipment I stock," she replied carefully, handing over the assembled kit. "This is exactly what I need," Dr. Martinez said, examining the carefully selected components. "You've anticipated everything I would have requested." As the helicopter medic left, Claire felt the familiar tension that came from revealing too much of her background knowledge. She had worked hard to maintain her cover as simply a well-informed store clerk, but emergency situations had a way of drawing out instincts and expertise she preferred to keep hidden. The afternoon continued with a steady stream of emergency personnel, each bringing reports from the accident scene that painted an increasingly complex picture. The initial collision had involved a semi-truck losing control on the steep downgrade, triggering a chain reaction that ultimately involved 12 vehicles. Several victims remained trapped, requiring specialized extrication equipment, while others had been transported to hospitals throughout the region. Around 4 o'clock, Marcus Rodriguez returned to the store, his uniform showing the dirt and stress of hours spent working the accident scene. His usual composed demeanor was strained, and Claire could see the weight of the day's challenges in his posture. "Claire, I need to replenish our trauma supplies," Marcus said, his voice hoarse from hours of radio communications and shouted instructions at the chaotic scene. Claire began gathering the requested items, noting the exhaustion in Marcus's movements. "How are things progressing out there?" Marcus rubbed his eyes wearily. "It's been a nightmare. The location makes everything 10 times harder. We're dealing with steep terrain, limited access routes, and patients scattered across a quarter-mile stretch of highway." Brad Thompson entered the store as Marcus spoke, his earlier swagger replaced by the sobering reality of managing multiple critical patients. "Marcus, we need to get back out there. They've located another victim who was thrown from the original crash site." "Another victim?" Claire asked, unable to hide her concern. "Yeah, apparently someone was ejected from one of the vehicles and landed in the ravine beside the highway," Brad explained. "Took hours to find them because of the heavy brush. State police are saying it's a miracle they're still alive." Marcus signed for the supplies, his expression grim. The problem is getting them out. The terrain is too steep for normal evacuation procedures, and the helicopter can't land because of the trees. We're looking at a ground evacuation that could take hours. Hours? Claire felt her professional instincts stirring. What's the patient's condition? Unconscious, possible spinal injuries, suspected internal bleeding. Marcus replied automatically, then paused as he realized he was discussing medical details with someone he considered a civilian. Not that you need to worry about the medical aspects. Brad nodded in agreement. Yeah, this is definitely beyond civilian understanding. We're dealing with complex trauma protocols that require years of specialized training. Claire bit back her immediate response, instead focusing on completing their supply order. She had learned to endure such dismissive comments, but they stung more deeply when lives were hanging in the balance. Kevin Walsh entered the store as she finished packaging their supplies, his face showing the strain of the prolonged emergency response. Marcus, we've got a problem. The patient in the ravine is deteriorating faster than we anticipated. Dr. Chen from Mercy General is saying they need surgical intervention within the next 2 hours, or we're going to lose them. 2 hours? Marcus shook his head. With the extraction time and transport to the hospital, we're looking at 3 hours minimum. That's assuming everything goes perfectly. Can't life flight get closer? Brad asked. Kevin shook his head. The trees are too dense, and the terrain is too unstable for a rope evacuation. They'd have to clear a landing zone, which would take even longer. Claire listened to the discussion while maintaining her professional demeanor, but internally she was calculating options and alternatives based on her knowledge of emergency medicine. The situation they were describing was exactly the kind of challenge that required innovative thinking and aggressive intervention. What about setting up a field surgery unit? She asked, before she could stop herself. The 3 paramedics turned to look at her with expressions ranging from surprise to condescension. Marcus raised an eyebrow. Field surgery? Claire, that's not something you see in medical supply catalogs. Field surgery requires specialized surgeons, sterile environments, and equipment that we don't have access to. Besides, Brad added with barely concealed amusement, this isn't a war zone. We have hospitals with fully equipped operating rooms. We just need to get the patient there safely. But if the patient can't survive the transport time, Claire began. That's where triage comes in. Kevin interrupted, his tone patient but patronizing. Sometimes you have to make difficult decisions about resource allocation. It's part of emergency medicine that civilians don't usually understand. Claire felt her frustration building but maintained her composure. Of course. I was just thinking about alternatives. Marcus gathered their supplies, his expression softening slightly. Look, Claire, I appreciate your concern, but emergency medicine involves split-second decisions based on years of training and experience. What seems logical in theory often doesn't work in practice. Exactly, Brad agreed. You can't just read about trauma surgery and think you understand it. When someone's life is on the line, you need people who've actually done it before. Tom Fisher burst through the door at that moment, his radio crackling with urgent communications. Guys, we need to move now. The patient in the ravine just went into cardiac arrest. They managed to get them stabilized, but barely. Dr. Chen is saying we've got maybe an hour before they're beyond help. The atmosphere in the store immediately shifted to crisis mode. Marcus grabbed the supply bags, his earlier exhaustion replaced by focused urgency. Tom, prep the ambulance. Kevin, radio ahead to Mercy General and tell them we're coming in hot with a code blue trauma. What about the extraction? Brad asked. Fire department finally got them out using a Stokes basket and rope system, Tom replied. They're loading them into Unit 12 now, but Marcus, the patient is barely hanging on. Vitals are all over the place, and they're showing signs of severe internal bleeding. Marcus paused at the door, his expression troubled. Unit 12? That's Rodriguez and Stevens. They're good, but they're not equipped for this level of trauma support. That's the only unit available, Tom said. Everyone else is still dealing with other victims from the main crash site. Claire watched the paramedics prepare to leave, her mind racing through the medical implications of what she was hearing. A patient with severe internal bleeding and unstable vitals facing an hour-long transport in an ambulance with limited surgical capabilities. The mathematics of the situation were stark and unforgiving. "Marcus," she said quietly, "what if the patient doesn't make it to the hospital?" Marcus turned back, his expression showing the weight of responsibility he carried. "Then we'll have done everything we could with the resources available. That's all anyone can ask. But what if there were other options?" Brad shook his head impatiently. "Claire, there aren't other options. This isn't a medical drama where someone performs miraculous surgery in impossible conditions. This is real life with real limitations." "Exactly," Kevin added. "Emergency medicine is about working within established protocols and procedures. You can't just improvise when someone's life is at stake." Claire felt the familiar sting of dismissal, but this time it was compounded by her knowledge of what might be possible with the right intervention. She watched the paramedics leave, their radios crackling with updates from the accident scene and the struggling patient in Unit 12. As the store fell quiet again, Claire found herself pacing behind the counter, her mind churning through possibilities and scenarios. She understood the paramedics' adherence to established protocols, but she also knew that sometimes protocols weren't enough. Sometimes situations arose that required thinking beyond standard procedures. Her phone rang, interrupting her thoughts. "MedTech Supply, this is Claire." "Claire, it's Dr. Vance again. We just received word that Unit 12 is en route with a critical trauma patient, but they're reporting significant complications during transport. The patient is deteriorating rapidly, and there's concern they won't survive the journey." "What kind of complications?" Claire asked, though she suspected she already knew. "Internal bleeding that's not responding to field treatment, dropping blood pressure, and signs of hypovolemic shock. The paramedics are doing everything they can, but they're limited in what they can accomplish in a moving ambulance." Claire closed her eyes, visualizing the scene in the ambulance. Two paramedics working frantically in a cramped space, trying to stabilize a patient whose condition was beyond their training and equipment capabilities. It was exactly the kind of situation where traditional protocols fell short. "Dr. Vance, what would happen if someone with surgical experience was available to intervene during transport?" There was a pause on the other end of the line. "What do you mean?" "Hypothetically, if someone qualified could perform emergency surgery in the ambulance, would that change the patient's chances?" "Claire, emergency surgery in a moving vehicle is incredibly dangerous and technically challenging. It would require someone with extensive trauma surgery experience and nerves of steel. Even then, the success rate would be questionable." "But it would be possible?" "Theoretically, yes. There have been cases of battlefield surgery and emergency procedures in unconventional settings. But we're talking about someone with years of surgical training and experience with high-pressure situations." After hanging up, Claire stood alone in her store, surrounded by the medical equipment that had become her refuge from her former life. Outside, she could hear sirens in the distance, knowing that somewhere in an ambulance racing toward the hospital, a patient was dying while two dedicated paramedics did everything their training allowed. The weight of her hidden knowledge pressed down on her like a physical burden. She had spent years building a quiet life that kept her away from the intensity and emotional demands of surgery, but situations like this tested every aspect of her carefully constructed boundaries. Claire walked to the back of her store, where she kept her personal medical bag locked in a secure cabinet. She had maintained it out of habit more than expectation, a remnant of her former life that she couldn't quite abandon. The bag contained surgical instruments, sterile supplies, and emergency medications that went far beyond what a medical supply store clerk would typically possess. As she stood looking at the cabinet, Claire heard her radio scanner picking up communications from Unit 12. The voices were tense, professional, but edged with the kind of controlled desperation that came when protocols weren't enough. "Mercy General, Unit 12. Patient's blood pressure is dropping despite fluid resuscitation. We're pushing dopamine, but response is minimal. ETA, still 30 minutes. Unit 12. Continue current protocols. We're preparing Trauma Bay 1 for immediate surgical intervention upon arrival. Copy, Mercy General. Be advised, patient is showing signs of severe internal hemorrhaging. We may not have 30 minutes. Claire listened to the exchange, her hands clenching and unclenching as she fought between her ingrained instinct to help and her determination to maintain her carefully constructed distance from emergency medicine. She thought of Marcus, Brad, and Kevin, who had dismissed her knowledge and expertise just hours earlier, now facing a situation that might be beyond their capabilities. The radio crackled again with an update that made Claire's decision for her. All units. Unit 12 is requesting immediate assistance. Patient is in cardiac arrest. They're performing CPR en route, but prognosis is poor. Any available medical personnel in the area are requested to respond. Claire stared at her medical bag for one more moment, then unlocked the cabinet with hands that were steadier than she expected. If she was going to break her self-imposed exile from emergency medicine, there was no better reason than a dying patient and paramedics who needed help, whether they wanted to admit it or not. Claire's delivery van cut through the afternoon traffic with unusual urgency as she followed the route she knew Unit 12 would take to Mercy General Hospital. Her medical bag sat secured in the passenger seat, its familiar weight both comforting and terrifying after years of deliberate avoidance. The radio scanner mounted on her dashboard crackled with increasingly desperate updates from the ambulance crew ahead. Mercy General, Unit 12. We've restored pulse, but blood pressure remains critically low. Patient is unconscious and unresponsive. We're losing them. Marcus Rodriguez's voice carried a strain that Claire had never heard before, the controlled professionalism cracking under the weight of a deteriorating situation. She pressed harder on the accelerator, her mind automatically calculating the distance to various points along their route where she might intercept the ambulance. Unit 12, this is Dr. Vance at Mercy General. What's your current position? We're approaching the Oak Ridge overpass, about 15 minutes out. Dr. Vance, I need to be honest with you. This patient needs surgical intervention now. We're doing everything we can, but it's not enough. Claire knew the Oak Ridge overpass well. It was a long, straight stretch of highway with wide shoulders where emergency vehicles sometimes pulled over for equipment transfers or crew changes. If she was going to intercept Unit 12, that would be her best opportunity. Her hands tightened on the steering wheel as doubt crept into her mind. She had maintained her surgical skills through private practice and continuing education, but it had been 3 years since she had worked on a living patient. 3 years since the incident that had driven her away from trauma surgery and into the safe, predictable world of medical supply. The radio crackled again with Tom Fisher's voice from the dispatch center. Unit 12, be advised that Dr. Martinez from Life Flight is attempting to rendezvous with you at mile marker 42. She may be able to provide additional support. Negative. Dispatch. Dr. Martinez is still dealing with another critical patient from the main accident site. We're on our own out here. Claire reached for her radio handset, then hesitated. Once she made contact, there would be no going back. She would be exposing herself and her background in a way that would forever change her carefully constructed life in Cedar Falls. But as she listened to the increasing desperation in Marcus's voice, she realized that her comfortable anonymity was a luxury she could no longer afford. Unit 12, this is Claire Hartwell from MedTech Supply. I'm approximately 2 miles behind your position and may be able to provide assistance. The radio fell silent for several seconds before Marcus's voice returned, tinged with confusion and frustration. Claire, this is not the time for civilians to get involved. We appreciate your concern, but we need clear radio channels for emergency communications. Marcus, I have advanced medical training and surgical equipment. If you're willing to consider unconventional options, I might be able to help your patient. Brad Thompson's voice cut through the transmission with barely concealed irritation. Claire, with all due respect, this is way beyond medical supply store knowledge. We're dealing with severe trauma that requires specialized expertise. Claire took a deep breath, knowing that her next words would irrevocably change her relationship with the Cedar Falls emergency medical community. I'm a trauma surgeon. I've been practicing emergency medicine for 15 years, including 5 years in military trauma units. If your patient is dying, I might be their best chance. The silence that followed her revelation stretched for nearly 30 seconds, filled only by the ambient noise of radio static and the hum of her van's engine. Claire could almost feel the shock and disbelief radiating from the ambulance crew ahead of her. Kevin Walsh's voice finally broke the silence, his tone carefully controlled. Claire, are you saying you're actually a doctor? I'm saying I have the training and experience to perform emergency surgery if that's what your patient needs to survive. Marcus's voice returned, heavy with skepticism and the pressure of a rapidly deteriorating situation. Even if that's true, and I'm not saying I believe it, you can't perform surgery in a moving ambulance. The conditions are impossible. The sterility issues alone would kill the patient. Not necessarily, Claire replied, her confidence growing as she fell back into familiar medical reasoning. Emergency field surgery has been performed successfully in far worse conditions. If the patient is going to die anyway, the risk-benefit analysis supports aggressive intervention. This is insane, Brad interjected. Marcus, we can't seriously be considering letting some random store clerk operate on our patient based on claims we can't verify. Claire could hear the sound of medical equipment alarms in the background of their transmission, indicating that the patient's condition was continuing to deteriorate. She knew that Marcus was facing an impossible decision: trust protocols and watch his patient die, or take an enormous risk on someone whose credentials he couldn't verify. Claire, Marcus said finally, his voice tight with controlled desperation, even if you are who you claim to be, performing surgery in the back of a bouncing ambulance is not the same as working in a sterile operating room. The liability issues alone. Marcus, forget about liability. Your patient is dying. You said it yourself. They need surgical intervention now. I can provide that intervention if you're willing to stop the ambulance and let me try. Stop the ambulance? Kevin's voice carried disbelief. Claire, every minute we delay getting to the hospital reduces this patient's chances of survival. Every minute you spend driving toward a hospital they won't live to reach reduces their chances to zero, Claire countered. I'm offering you a third option that might actually save their life. The radio fell silent again as Claire approached the Oak Ridge overpass. She could see Unit 12 in the distance, its emergency lights cutting through the gray afternoon. The ambulance was maintaining steady speed toward the hospital, but she could sense the internal debate raging among its crew. Dr. Vance's voice suddenly joined the conversation from Mercy General. Unit 12, what's the patient's current status? Dr. Vance, blood pressure is barely measurable, heart rate is erratic, and we're seeing signs of hypovolemic shock that's not responding to our interventions. Honestly, I don't think they're going to make it to the hospital. Claire seized the opening. Dr. Vance, this is Claire Hartwell. I've been monitoring your radio traffic. If Marcus is willing to stop the ambulance, I can attempt emergency surgery to control the internal bleeding. Who is this? Dr. Vance asked, her voice sharp with authority. How did you get access to emergency radio frequencies? I'm a trauma surgeon offering to help save your patient's life, Claire replied simply. Marcus can verify my credentials later. Right now, the question is whether you're willing to try something unconventional to save someone who's going to die under conventional treatment. Marcus's voice cut through the exchange, heavy with the weight of command responsibility. Claire, I need you to understand what you're asking. If I stop this ambulance and let you operate on our patient, I'm betting their life on your word. If you're wrong, if you're not who you claim to be, if something goes wrong, this person dies because of my decision. And if you don't stop, they die anyway, Claire replied quietly. Marcus, you're a good paramedic. You know this patient isn't going to survive the transport. You're facing a choice between certain death and possible life. The Oak Ridge overpass stretched ahead, its wide shoulders offering space for the ambulance to safely pull over. Claire could see Unit 12 beginning to slow, and her heart rate quickened as she realized that Marcus was actually considering her proposal. Unit 12, this is Dr. Vance. I need to ask directly, what is your assessment of the patient's survivability under current treatment protocols? Marcus's response came after a long pause, his voice heavy with professional honesty. Dr. Vance, based on current trajectory, I don't believe this patient will survive transport to the hospital. We're losing them despite our best efforts. And you believe this woman claiming to be a surgeon might be able to help? I don't know what to believe, Marcus admitted, but I know what I'm seeing in this ambulance, and it's not good. Claire watched as Unit 12's brake lights illuminated and the ambulance began pulling toward the shoulder of the overpass. Her mouth went dry as she realized that her bluff was about to be called in the most dramatic way possible. She had committed herself to a course of action that would either save a life or expose her as a fraud in front of the entire Cedar Falls emergency medical community. As she pulled her van behind the stopped ambulance, Claire caught sight of her reflection in the rearview mirror. The woman looking back at her bore little resemblance to the confident trauma surgeon she had once been. Her hair was pulled back in a simple ponytail, her face free of makeup, her clothes the practical scrubs of a medical supply clerk. But her eyes held the focused intensity that had carried her through countless emergency surgeries. Marcus appeared at the ambulance's rear doors, his expression a mixture of desperation and skepticism. Behind him, she could see Brad and Kevin working frantically over a patient whose pale, unconscious form told its own story of critical blood loss. "Claire," Marcus said as she approached with her medical bag, "I'm trusting you with someone's life based on nothing more than your word. I hope you understand the magnitude of what you're claiming you can do." Claire looked past him at the patient, her trained eye immediately cataloging the signs of severe internal hemorrhaging and hypovolemic shock. The monitors showed dangerously low blood pressure, rapid but weak pulse, and oxygen saturation that was dropping despite supplemental oxygen. This was exactly the kind of case she had handled dozens of times in military trauma units, but never under these conditions. "I understand," she replied, her voice steady despite the magnitude of what she was about to attempt. "Marcus, I need you to understand something too. If we do this, you're not just trusting me with your patient's life, you're trusting me with your career, your reputation, and your peace of mind. Are you prepared for that?" Brad looked up from the patient, sweat beading on his forehead despite the cool afternoon air. "Marcus, this is crazy. We should be moving toward the hospital, not stopping for some elaborate medical fantasy." "Look at the monitor, Brad," Marcus replied quietly. "Look at those vitals and tell me this patient is going to survive another 10 minutes of transport, much less the full trip to Mercy General." Kevin stepped out of the ambulance, his expression troubled. "Marcus, even if she is a doctor, the conditions in there are impossible. No sterile field, poor lighting, vehicle vibration, limited space. It's not just unconventional, it's dangerous." Claire set her medical bag down and began methodically laying out surgical instruments on a sterile drape. Her movements were automatic, muscle memory taking over as she fell back into the familiar rhythm of surgical preparation. The instruments gleamed in the afternoon light, their quality and sophistication clearly visible to the paramedics who had spent their careers working with emergency medical equipment. "Those are surgical instruments," Kevin observed, his voice carrying a note of surprise. "Real ones, not the basic tools we carry." "Where did you get equipment like that?" Brad asked, his skepticism beginning to waver as he examined the array of specialized surgical tools. Claire looked up from her preparations, meeting each of their gazes in turn. "From 15 years of trauma surgery, including deployments in Afghanistan and Iraq, where I learned to operate under conditions that make this ambulance look like a luxury suite." The weight of her words settled over the group as they began to understand that this might not be an elaborate deception. The surgical instruments, her confident handling of medical terminology, her calm demeanor in the face of a critical emergency, all pointed toward someone with genuine medical expertise. Marcus stared at the instruments, then back at Claire. "If you're really a surgeon, why are you working in a medical supply store?" "That's a conversation for another time," Claire replied, pulling on sterile gloves with practiced efficiency. "Right now, the question is whether you're going to let me try to save your patient's life, or whether we're going to stand here debating my credentials while they bleed to death." The patient's monitor alarm suddenly shrieked, indicating cardiac arrest. Brad immediately began chest compressions while Kevin prepared to administer emergency medications. The crisis had escalated beyond theoretical discussions and professional doubts. "Marcus," Claire said urgently, "your patient just went into cardiac arrest. CPR and drugs might bring them back temporarily, but without surgical intervention to stop the bleeding, they're going to arrest again. How many times do you think you can resuscitate them?" Marcus looked at his patient, at his crew working desperately to restore vital signs, and at Claire standing ready with surgical instruments that represented possibilities beyond his training. The decision was no longer about protocols or procedures. It was about life and death, and whether he was willing to trust an unknown variable in the most critical moment of his career. "Do it," he said finally, his voice barely audible over the sound of medical alarms. "God help us all, but do it." Claire stepped into the cramped ambulance compartment with the fluid grace of someone returning to familiar territory. The space that had seemed impossibly small in chaotic moments before suddenly transformed into her operating theater. Her trained eyes quickly assessed the patient, cataloging injuries and vital signs with the efficiency that had made her one of the most sought-after trauma surgeons in military medicine. The patient was a woman in her early 30s, unconscious and pale from massive blood loss. Multiple lacerations covered her torso, but Claire's attention focused immediately on the signs of internal abdominal bleeding that had been beyond the paramedics' ability to address. The distended abdomen and rigid muscle guarding told a clear story of hemorrhaging that required immediate surgical intervention. "Brad, I need you to maintain pressure on that external laceration while I work," Claire commanded, her voice carrying the unmistakable authority of someone accustomed to life-and-death decision-making. "Kevin, prepare 2 units of saline and have epinephrine ready in case we lose her rhythm again." The paramedics found themselves automatically following her instructions, their training responding to the confidence and expertise in her voice. Marcus positioned himself where he could assist while maintaining visual contact with the patient's monitors, his skepticism rapidly giving way to professional recognition of surgical competence. Claire worked with methodical precision, her hands steady despite the confines of the ambulance. She administered local anesthesia around the proposed incision site, her movements economical and purposeful. "Marcus, I need you to understand that what I'm about to do violates every principle of sterile surgical technique, but under these circumstances, infection is a secondary concern to exsanguination." "I understand," Marcus replied, watching in fascination as Claire prepared for surgery under conditions that would challenge the most experienced emergency physician. "What do you need from us?" "Absolute stillness when I tell you, and complete trust in my judgment," Claire answered, positioning her scalpel over the patient's abdomen. "This woman has approximately 10 minutes of viable blood volume remaining. If I can identify and control the bleeding source, she has a chance. If not, she dies regardless of what we do." The first incision was clean and decisive, cutting through skin and subcutaneous tissue with the precision of someone who had performed similar procedures hundreds of times. Blood immediately welled up from the wound, but Claire had anticipated this and quickly applied hemostatic clamps to control the bleeding from severed vessels. Kevin watched in amazement as Claire's hands moved with practiced efficiency through tissue layers, her fingers seemingly knowing exactly where to cut and what to avoid. "How are you doing that without being able to see clearly?" 15 years of experience," Claire replied without looking up from her work. "In military trauma surgery, you learn to work by feel as much as by sight. Anatomy doesn't change, even under adverse conditions." As she entered the peritoneal cavity, a significant amount of blood escaped, confirming her diagnosis of internal hemorrhaging. Claire quickly inserted retractors to maintain visibility, her movements adapted to the cramped conditions, but losing none of their surgical precision. "There," she said quietly, identifying the source of bleeding as a lacerated spleen, splenic laceration with active hemorrhaging. In a hospital, this would be a straightforward repair, but here we have limited options. Brad leaned closer, his earlier skepticism replaced by genuine curiosity about what he was witnessing. "What are you going to do?" "Splenectomy," Claire replied matter-of-factly. "Remove the spleen entirely. It's not ideal, but it's the only way to control the bleeding under these conditions." Marcus felt his heart rate increase as he realized the magnitude of what Claire was attempting. "You're going to remove an entire organ in the back of an ambulance?" "I'm going to save her life," Claire corrected, beginning the delicate process of isolating the splenic vessels. The spleen is not essential for survival, but bleeding to death definitely is fatal. Her hands worked with remarkable steadiness despite the unconventional operating environment. She carefully ligated blood vessels, her suturing technique flawless, even in the confines of the ambulance. The paramedics watched in silent amazement as she systematically addressed each bleeding point with the confidence of someone who had performed similar procedures countless times. "Vitals are stabilizing," Kevin reported, his voice filled with disbelief. "Blood pressure is coming up, and heart rate is becoming more regular." Claire continued working, her concentration absolute as she removed the damaged spleen and ensured that all bleeding had been controlled. The procedure that would have taken an hour in a hospital operating room was completed in less than 20 minutes, under field conditions that would have challenged the most experienced military surgeon. "Irrigation and closure," she announced, beginning the process of cleaning the surgical site and preparing to close the incision. "Brad, how are those external lacerations looking?" "Controlled," Brad replied, still staring at what Claire had accomplished. "I can't believe what I just witnessed." As Claire began closing the abdominal incision with precise, even sutures, Marcus found his voice again. "Claire, I owe you an apology." "We all do. What you just did was extraordinary." "What I just did was emergency medicine," Claire replied, her attention still focused on her suturing. Sometimes extraordinary circumstances require extraordinary measures. Kevin continued monitoring the patient's vital signs, watching as blood pressure and pulse steadily improved. She's responding beautifully, color is returning, and her oxygen saturation is climbing. Claire completed the final sutures and stepped back to assess her work. The surgical site was clean and properly closed, with no signs of continued bleeding. The patient's overall condition had dramatically improved. Her vital signs now stable enough for safe transport to the hospital. Now we can get her to Mercy General, Claire said, removing her surgical gloves and beginning to pack up her instruments. She'll need blood transfusions and monitoring for complications, but the immediate threat to her life has been eliminated. Tom Fisher's voice crackled over the radio from dispatch. Unit 12, what's your status? You've been stationary for over 30 minutes. Marcus picked up the radio handset, his voice carrying a mixture of amazement and professional pride. Dispatch Unit 12. We encountered complications that required field surgical intervention. Patient condition has been stabilized and we're resuming transport to Mercy General. Did you say surgical intervention? Tom's voice carried disbelief. Marcus, are you telling me someone performed surgery in your ambulance? Marcus looked at Claire, who was quietly cleaning her instruments with the same methodical precision she had shown throughout the procedure. Affirmative. Dispatch. Emergency splenectomy performed under field conditions by a qualified trauma surgeon. The radio fell silent for several seconds before Dr. Vance's voice joined the conversation. Unit 12, did I hear correctly that emergency surgery was performed during transport? Dr. Vance, this is Claire Hartwell. I performed an emergency splenectomy to control internal hemorrhaging. The patient is now stable and ready for hospital evaluation. Claire Hartwell? Dr. Vance's voice carried recognition and surprise. Are you Drive? Claire Hartwell, who worked trauma surgery at Walter Reed Medical Center. Claire paused in her cleanup, suddenly aware that her carefully constructed anonymity was completely shattered. Yes, Dr. Vance. That's correct. My God, Dr. Vance exclaimed. Marcus, do you realize who just operated on your patient? Dr. Hartwell was one of the most respected trauma surgeons in military medicine. She saved hundreds of lives in combat conditions. Brad stared at Claire with new understanding. You're famous in the medical community? I was, Claire replied quietly. That was a different life. Marcus shook his head in amazement. Claire, why didn't you tell us who you were? Why are you working at a medical supply store? Claire finished packing her instruments, her expression thoughtful. Because sometimes people need to start over, and sometimes the best place to help people isn't where everyone expects you to be. As Unit 12 resumed its journey to Mercy General, the atmosphere in the ambulance had completely transformed. The paramedics who had dismissed Claire's expertise hours earlier now watched her with genuine respect and admiration. The patient she had saved lay peacefully, her vital signs strong and stable. Kevin monitored the patient's condition during transport, marveling at the dramatic improvement that had resulted from Claire's intervention. Dr. Hartwell, that was the most incredible thing I've ever witnessed in 25 years of emergency medicine. Please, just call me Claire, she replied with a tired smile. And what you witnessed was teamwork. None of this would have been possible without your assistance and Marcus's willingness to trust an unconventional solution. Brad could barely contain his excitement about what he had experienced. Claire, I have to ask, how many times have you performed surgery under conditions like this? More times than I care to remember, Claire answered honestly. Military medicine teaches you to work with whatever resources you have available. Sometimes that means operating in the back of a Humvee during combat. Sometimes it means improvising solutions that would never be attempted in civilian hospitals. Marcus studied Claire's face, seeing past the modest demeanor to the depth of experience and skill that had made her intervention possible. Why did you leave trauma surgery? Someone with your abilities could work anywhere. Claire was quiet for a long moment, watching the patient she had saved breathing peacefully. Because saving lives comes with a cost, and sometimes that cost becomes too high to pay. I needed to find a different way to help people. But you came back today, Kevin observed. When it mattered most, you came back. Yes, Claire agreed simply. I came back. The radio crackled with Dr. Vance's voice as they approached the hospital. Unit 12. Trauma Bay 1 is prepared for your arrival. I've assembled our best surgical team to evaluate Dr. Hartwell's fieldwork. Dr. Vance, Claire interjected, the patient should recover fully with appropriate post-operative care. The splenectomy was successful, and all bleeding has been controlled. Dr. Hartwell, I look forward to discussing your technique with our surgical staff. What you've accomplished today is remarkable. As the ambulance pulled into the hospital bay, Claire felt the familiar mixture of satisfaction and exhaustion that followed successful trauma surgery. She had saved a life under impossible conditions, but more importantly, she had proven to herself that her skills and instincts remained sharp, despite years away from active practice. Marcus turned to her as they prepared to transfer the patient to the hospital team. Claire, I don't know how to thank you. We would have lost her without your intervention. You don't need to thank me, Claire replied. You trusted me when everything in your training told you not to. That took more courage than anything I did. The hospital team rushed forward to receive the patient, Dr. Vance leading the group with obvious curiosity about the field surgery that had been performed. As the patient was transferred to a hospital gurney, her vital signs remained stable, a testament to the skill of the woman who had saved her life in the most unlikely of operating rooms. Dr. Vance examined the surgical site with obvious admiration. This is textbook work, Dr. Hartwell. The suturing is perfect, and there are no signs of complications. How did you achieve this level of precision under field conditions? Practice, Claire replied modestly. And excellent assistance from your paramedic crew. As the patient was wheeled into the trauma bay, Marcus, Brad, and Kevin stood with Claire in the ambulance bay, all of them processing what they had just experienced. The woman they had dismissed as a simple store clerk had revealed herself to be one of the most skilled surgeons any of them had ever encountered. Claire, Marcus said finally, I owe you more than an apology. I owe you my respect and my gratitude. What you did today will change how I think about assumptions and expertise. Claire smiled, the first genuine smile any of them had seen from her. Marcus, you're a good paramedic, and you made the hardest decision any emergency responder can make. You chose to trust someone new when everything familiar wasn't working. As they prepared to clean and restock the ambulance for their next call, the paramedics found themselves looking at Claire with completely different eyes. The modest woman in simple scrubs was revealed to be a highly skilled professional whose quiet competence had just saved a life in ways they had never imagined possible. 3 hours later, Claire sat in the hospital cafeteria nursing a cup of coffee that had long since grown cold. Word of the ambulance surgery had spread through Mercy General like wildfire, and she had found herself fielding questions from doctors, nurses, and administrators who couldn't quite believe what they were hearing. The patient she had operated on was stable in the intensive care unit, her recovery progressing exactly as Claire had predicted. Dr. Vance approached her table, carrying her own cup of coffee and wearing the expression of someone still processing extraordinary events. Mind if I join you? Claire gestured to the empty chair across from her. Of course. Dr. Vance settled into her seat, studying Claire with obvious curiosity. I've been reviewing your patient's post-operative scans. The surgical work is flawless. Under normal circumstances, I would say it was textbook trauma surgery. Under the circumstances you worked in, I would say it was miraculous. It was necessary, Claire replied simply. Sometimes that's all that matters. I've been doing some research since you arrived, Dr. Vance continued. Dr. Claire Hartwell, Chief of Trauma Surgery at 3 different military hospitals, recipient of the Surgeon General's Award for Excellence, credited with developing new techniques for battlefield medicine. You disappeared from military medicine 3 years ago, and no one seemed to know where you went. Claire sipped her cold coffee, unsurprised that her background was catching up with her. I needed a break from trauma surgery. Cedar Falls seemed like a good place to find some peace. Working in a medical supply store, Dr. Vance observed, that must have been quite an adjustment. It was, Claire admitted, but there's something to be said for helping people without the constant pressure of life and death decisions. Dr. Vance leaned forward, her expression earnest. Claire, I have to ask, would you consider coming back to surgery? We have an opening in our trauma department, and after what I witnessed today, I can't think of anyone more qualified. Claire shook her head gently. Thank you, Dr. Vance, but I'm not ready for that. What happened today was an emergency situation. Going back to full-time surgery would require commitments I'm not prepared to make. What if it wasn't full-time? Dr. Vance pressed. What if we could arrange something flexible? consultation work, training programs, emergency backup when situations arise that require your level of expertise. Before Claire could respond, Marcus Rodriguez appeared at their table, still wearing his uniform but looking significantly different than he had that morning. The arrogance and dismissive attitude had been replaced by something approaching humility. "Dr. Hartwell, I hope I'm not interrupting," Marcus said, his voice carrying a deference that would have been unimaginable 12 hours earlier. "Please, sit down," Claire said, gesturing to another chair. "And please, call me Claire." Marcus sat down heavily, running his hands through his hair. "I've been thinking about today. About how wrong I was. How wrong we all were. I keep replaying our conversations, the way we dismissed you, the assumptions we made." "Marcus, you didn't know," Claire said kindly. "There was no reason for you to assume I had medical training." "That's just it," Marcus replied. "There was every reason to at least listen to what you were saying. Your knowledge of medical equipment, your understanding of emergency protocols, your suggestions about treatment options. We ignored all of it because you didn't fit our preconceptions of what medical expertise looks like." Dr. Vance watched the interaction with interest, recognizing the teaching moment that was unfolding. "Marcus, what do you think you learned from today's experience?" Marcus considered the question carefully. "I learned that expertise doesn't always come with the credentials we expect. I learned that assumptions can be dangerous, especially when lives are at stake. And I learned that sometimes the best solutions come from the most unexpected sources." Kevin Walsh and Brad Thompson entered the cafeteria, spotting their group and approaching with the same mixture of respect and bewilderment that had characterized their interactions with Claire since the surgery. Brad carried a small bouquet of flowers, which he presented to Claire with obvious embarrassment. "Dr. Hartwell, these are from the whole crew," Brad said, his earlier cockiness completely absent. "We wanted to thank you for what you did today, and to apologize for how we treated you." Claire accepted the flowers with a genuine smile. "Thank you, but you don't need to apologize. You were doing your jobs according to your training and experience." "No," Kevin interjected firmly. "We were being arrogant and dismissive. There's a difference between professional confidence and professional arrogance, and we crossed that line." Brad nodded in agreement. "I keep thinking about all the times we've encountered people with medical knowledge and dismissed them because they weren't paramedics or doctors. How many good ideas have we ignored because of our assumptions?" "The important thing is that you're thinking about it now," Claire replied. "Growth comes from recognizing our mistakes and learning from them." Marcus leaned back in his chair, his expression thoughtful. "Claire, can I ask you something personal? Why did you leave trauma surgery? Someone with your skills and reputation could work anywhere." Claire was quiet for a long moment, considering how much of her story to share. 3 years ago, I lost a patient during surgery, a young soldier, not much older than Brad here. I had performed the same procedure hundreds of times, but this time, something went wrong. Something I couldn't control, couldn't predict, couldn't fix. The table fell silent as Claire continued. Logically, I knew that not every patient can be saved. I had lost patients before, and I understood that it was part of medicine. But this case was different. This patient reminded me of my younger brother, who had died in a car accident when I was in medical school. Dr. Vance reached across the table and touched Claire's hand gently. "Grief has a way of compounding, especially in our profession. I started second-guessing every decision, questioning every procedure," Claire continued. "My confidence was shaken in a way I had never experienced. I realized I needed to step away before my uncertainty started endangering other patients." Kevin nodded with understanding. "So you came to Cedar Falls to heal." "I came to Cedar Falls to find a different way to help people," Claire corrected. "Working in the medical supply store allowed me to support emergency responders and healthcare providers without the direct pressure of patient care. It seemed like a good compromise." "But you came back today," Marcus observed. "When it mattered, you came back." Claire smiled at the memory of her decision to intercept the ambulance. "I realized that running away from medicine wasn't protecting anyone. That patient in your ambulance needed help, and I had the skills to provide it. Sometimes healing means facing the thing you're afraid of." Brad looked puzzled. "But weren't you afraid today? I mean, performing surgery in an ambulance under those conditions?" "Terrified," Claire admitted with a laugh. "But fear and action aren't mutually exclusive. Courage isn't the absence of fear. It's action in spite of fear. Dr. Vance turned back to her earlier offer. Claire, what you've described sounds like someone who's ready to consider returning to medicine, even if not full-time. Claire considered the suggestion thoughtfully. What did you have in mind? Emergency consultation, training programs for unusual circumstances, maybe some research into field surgery techniques, Dr. Vance explained. Nothing that would require you to carry the full emotional load of a trauma surgery position, but ways to use your expertise to help others. Marcus leaned forward eagerly. Claire, would you consider teaching some of our paramedic crews? After today, I realize we have gaps in our knowledge that could benefit from your experience. What kind of teaching? Claire asked. Advanced trauma assessment, field surgery techniques for extreme circumstances. Maybe some sessions on recognizing when conventional protocols aren't sufficient, Kevin suggested. Claire found herself intrigued by the possibilities. It would be different from traditional medical practice. Different can be good, Brad offered. Look at what happened today. Different thinking saved a life. Dr. Vance pressed her advantage. You could maintain your store, keep the life you've built here, but also share your expertise in ways that could save lives throughout the region. Claire thought about the patient recovering upstairs, about the satisfaction she had felt performing surgery again, about the possibility of contributing to emergency medicine without returning to the intense pressure of a full-time trauma position. I'd want to start small, she said finally. Maybe some training sessions, consultation on difficult cases, emergency backup for situations that exceed normal protocols. Marcus's face lit up with enthusiasm. Claire, that would be incredible. Having someone with your experience available for consultation could change how we handle complex cases. And it would give you a chance to ease back into medicine at your own pace, Dr. Vance added. No pressure, no expectations beyond what you're comfortable with. Claire looked around the table at the faces of people who had gone from dismissing her expertise to actively seeking her guidance. The transformation was remarkable, but more importantly, it felt genuine. All right, she said, her decision surprising even herself. Let's try it and see how it goes. The group erupted in smiles and expressions of gratitude, but Claire held up her hand. On one condition. I want to work with all of you to develop protocols for recognizing and utilizing medical expertise that might come from unexpected sources. Today taught us all that knowledge and skill don't always come in the packages we expect. Marcus nodded enthusiastically. Absolutely. We need to be better at listening to people who might have valuable input, regardless of their official credentials. Kevin agreed. I'm thinking about all the retired doctors, former military medics, nurse practitioners, and other healthcare workers in our community. We should have better ways to tap into that expertise during emergencies. Dr. Vance pulled out her phone to make notes. We could develop a registry of qualified individuals willing to provide emergency assistance, along with protocols for verifying credentials and utilizing their skills appropriately. Claire smiled at their enthusiasm. See, you're already thinking differently about how to approach problems. That's the most important change that can come from today. As the group began discussing practical details of training programs and consultation arrangements, Claire felt a sense of peace that had been missing from her life for 3 years. She had found a way to return to medicine that honored both her skills and her need for emotional balance. Brad looked at his watch and stood up reluctantly. We should probably get back to the station. It's been a long day, and we need to restock the ambulance. I'll walk out with you, Claire said, gathering her things. I should check on my store and make sure my assistant manager didn't have any problems. As they walked toward the hospital exit, Marcus turned to Claire with one final question. Do you think our patient will be okay? She'll be fine, Claire replied confidently. Full recovery, normal life expectancy, just without a spleen. She's lucky you were willing to take a risk on an unconventional solution. We're lucky you were there to provide one, Kevin corrected. Standing in the hospital parking lot as the sun set over the hills surrounding Cedar Falls, Claire realized that her carefully constructed new life hadn't been destroyed by the day's events. Instead, it had been expanded to include possibilities she hadn't allowed herself to consider. The paramedics who had mocked her that morning now looked at her with genuine respect and gratitude. More importantly, they looked at themselves differently, with increased awareness of their own assumptions and limitations. Sometimes, Claire said as they prepared to part ways, the most powerful thing we can do is admit that we don't know everything and remain open to learning from unexpected teachers. Marcus extended his hand to shake hers. "Thank you, Claire, for saving our patient, for teaching us about humility, and for showing us what's possible when we're willing to think beyond our usual boundaries." As Claire drove back to her modest store, she reflected on the day's transformation. She had started the morning as an anonymous medical supply clerk, content to help from the sidelines. She was ending it as someone who had found a way to bridge her past expertise with her present needs, creating possibilities she hadn't imagined. The radio scanner in her van crackled with routine emergency calls, the daily rhythm of a community served by dedicated professionals who now understood a little more about the complexity of expertise and the importance of staying open to unexpected solutions. Sometimes the most profound changes come not from dramatic gestures or grand announcements, but from quiet moments when people choose to trust each other despite their doubts. Sometimes healing happens not through avoiding challenges, but through facing them with the support of others who are willing to grow and learn together. The small medical supply store would reopen tomorrow, serving the emergency responders and healthcare providers of Cedar Falls. But now it would also serve as a reminder that expertise can be found in unexpected places, that assumptions can be dangerous, and that the most powerful response to doubt is not argument, but demonstration. In a world quick to judge and slow to listen, Claire Hartwell had shown that sometimes the most valuable gift we can offer is the chance to be surprised by each other's hidden strengths. Up next, you've got 2 more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out.